With that being said, were they racist? The answer is yes, but in a completely different way than I was ever used to. Now, the staff, amazing, very friendly, very sweet, very homey, like wholesome people that just genuinely believe in treating people well. Never had a problem with anybody in the staff. And if they were racist or off-putting, I really didn't notice it because I was in my own world and they stayed in theirs too. And I don't mind those type of racists because you should stay away from me. Why would you be racist and in my space? Like, that don't even make any sense. Stay the hell away from me, Carol. However,
being a black woman in healthcare, you literally have to be so strong, because the type of shit we be going through as black women, like, y'all ain't gonna be understanding if you're not black. And I meant that word for word. Okay, cool. So tell me why. So I'm a travel nurse. Okay, cool. I've been traveling for like almost 2 years right now. And I just finished a couple shifts and I have a couple off days. Cool. So my recruiter texts me and she's like, they're terminating your contract effective immediately. So I'm like, okay, cool. What's the reason? Because I want to know if it's something I did, because how am I gonna know what to do next time? She's like, well, they said a patient reported you, but they cannot say what because it's confidential. I'm like, a patient reported me and you cannot tell me why it's confidential? I said, so what happened the last time then when you was able to tell me what they said a patient say, and that wasn't even the case? I said, it's clearly because it don't have anything. That's why they kind of tell me, because there's nothing. I'm literally the only black lady on day shift as a nurse. I'm surrounded by all these folks, and you're trying to tell me a patient. All my patients, not to brag or anything, but I'm an exceptional nurse. And when I'm your nurse, I'm your nurse. I'm an advocate for you. I'm a do what's right. Like, literally my last shift before, I ended up staying 2 hours past my ending time because I was taking care of a patient no one wanted to. So one thing, when it comes regarding my nursing skills, ain't nobody gonna tell me that I'm not a good nurse, because I know damn well I am. And then I'm like, so did she tell you about all the positive feedbacks these patients been leaving for me? Oh no. Because how do you let 50 positive outweigh 1 negative? Even if there's no negative, I know there's no negative. How do you let that happen, right? And I was just to myself, I wasn't gonna extend at this place, but I was like, you know what? Let's just do it. At the end of the day, it's for your money. Just keep your cool and all that stuff. Trust your instincts. Trust your instincts. And I was like, the past 2 weeks, I'm like, something is up, because I usually pick up as much as I can. And I noticed that none of my shifts were being approved, right? So I told a few of my coworkers, I was like, hey, look at this. I was the first one to apply for this, and how it's not approved, these people come way after me as approved. I said, something is up. Something is up. Just wait for it. And I told my friend, I was like, if they're gonna fire me, might as well just go ahead with it. Why are they like pushing around? Little do I know. Anyways, guys, trust your instincts. And if you're a black young nurse, please keep going. These people are gonna try to take you down, and you gotta prove them different. Because to be honest, it's not gonna faze me, because at the end of the day, it's night, and at the end of the day, I know the type of nurse I am, and whatever scenario or evolution you're trying to paint about me, it ain't gonna do shit. Let's just say. Thank you for joining my TED Talk.
So real quick, I'm sitting in the garage at work before I clock in, because I got to clock in just a few minutes, okay? I don't think we talk enough about what it's like to be a black girl in nursing, especially if you're a black girl in critical care spaces, okay? Like me, I've been a nurse for 5 years. I came in at the beginning of the pandemic. I landed my job 6 months before I graduated, which was
pandemic wasn't even a thing, okay? Pandemic hit as I was leaving nursing school. The very first job I had, I was a neuro ICU nurse with cross-training to surgical and transplant ICU. The manager refused flat out to hire. She did not want to hire me for nothing. She kept trying to talk me out of it. It's so fast-paced, it's this, it's that. I don't think you would be able to handle it. All these other things, just to find out that another student that I was with when we was in nursing school got hired on at the exact same unit. And I only knew that because when we went to orientation, she was sitting there right next to me and said, no, she never said that to me. The same way when I was wanting to work P, which I'm in Peds now, but the old hospital I worked at, I wanted to work Peds. They kept saying, we don't hire new grads, we don't hire new grads, we don't hire new grads. And 3 of my white counterparts walked straight into NICU and pediatric ICU positions, okay? This is what I'm talking about. This is the gatekeep that comes with trying to be a black girl in a space that is not meant for you, that is not that you don't fit the aesthetic of the unit, okay? And again, I'm not saying if this is a current situation, because it's not, but in my experience, this is the things that have been happening. And then when you get into these spaces, it's a mean girl environment. They want to try to drive you out. They want to try to make it hard for you. They want to try to limit your education and the things that you know, so they can make it seem like you're not competent or you're not up to par. Now, prime example is, as I was on orientation as a brand new baby nurse, they put me with a preceptor who she literally verbatim told me, unless you ask me a question, there's nothing that I could tell you. I don't tell you anything. You must ask me. As I'm handling drips and CRT machines. So I basically followed her around for the first few days, and I'm like, well, I don't know what I should be asking. Why don't you just tell me what I need to be asking, or show me what I need to know? And so they finally put me with another preceptor, right? Anyway, they put me with another preceptor, and the experience was just a little bit better, not too much better, but it was a little bit better. Now, what happens is also, what I noticed is that I would get the shittiest of the shittiest assignments. They would throw me to the wolves, but they don't know I got that dog in me. I'm about that bark. I got the bark and the bite to match. I'm a swim before I sink, okay? I'm gonna make sure that I got all the stuff that I need. And if I don't, baby, I know how to look up and ask for help. I know how to figure this out. So I also want to sit there and say that just be mindful of the type of nurse that you're going to be and the type of nurse that you are, especially if you're wanting to get into these spaces like the ED, the ER, whatever you want to call it, ICUs, things like that, because a lot of times it is not meant for you, and they will try to do their best to drive you out. They will do their best to say that you're not being cohesive to the unit, you're not communicating enough, you're not a part of the team, it seems hostile. They watch every single thing you do. You cannot do what they do. If 1 million people are walking around with AirPods in their ears, you cannot. If 1 million people are walking around talking and laughing about their day, cussing and stuff, you cannot, because that is the goal, to get you out. Not every place. I'm just saying, as a generalization, be careful what you say and what you do inside, especially when you know that you know what you know. A lot of times your knowledge will be questioned. People can go behind you about your patients. A lot of times anonymous reports get sent. Just protect yourself and protect your license, okay? And that's all I want to say for all the new nurses that are coming in. If you're a black nurse and you're coming in and you're thinking this is what you want to do, first of all, don't take no for an answer. Second of all, protect your license. Third of all, know that you have all the tools that you need with you, and do some studying outside of work. Look up your hospital's policies and procedures. That way they can't tell you that something is not right when you know you followed it to the T. Okay? Love you. Bye.
Hey y'all, what's up? So I just got finished talking to my students about the different locations that you can work in, the different cultural experiences, and the racism that you may experience. But I realized it was a story time that y'all need to come hither for, because it was the time that I was the only black nurse working in the whole entire hospital. So come here. So I'm from Philly, inner city, and every hospital that I've worked at has been a level 1 trauma center or close to it, right? But I took a travel assignment in Gettysburg, PA, and I was there for 2 years. I enjoyed it so much, and I had such a great time, and the staff was so amazing that I stayed there for multiple assignments. Now, if you're not familiar with Gettysburg, if you hear of the Battle of Gettysburg, yes, that's Gettysburg. Now, I know most of y'all ain't never been to Gettysburg, but if you have, you would know that Gettysburg is a mostly white town. I was there for almost 2 years, and there was not one other black staff of any kind. They also have mostly white patients. I may have had, in almost 2 years, I may have had 1 or 2 black patients, and they weren't from Gettysburg. Gettysburg borders Maryland, so every once in a while you get a few people that come over the border. Now, when I tell people this, they immediately assume that it's going to be the most racist environment that I ever encountered, and it must have been horrible, and oh my God, and it actually was the opposite. Let me just give you a little bit more context. These are some country folks, and I mean more than regular country. I mean, the nurses wear skirts. They usually are married very young. A lot of them were homeschooled and or homeschool their own children. Some of them live on acres of land. A lot of them come in with food that their husband either caught or goat milk that their goat actually milked. Yes, there were some modern staff that were closer to city girls like me, but I'm just telling you the norm. With that being said, were they racist? The answer is yes, but in a completely different way than I was ever used to. Now, the staff, amazing, very friendly, very sweet, very homey, like wholesome people that just genuinely believe in treating people well. Never had a problem with anybody in the staff. And if they were racist or off-putting, I really didn't notice it because I was in my own world and they stayed in theirs too. And I don't mind those type of racists because you should stay away from me. Why would you be racist and in my space? Like, that don't even make any sense. Stay the hell away from me, Carol. However, the patients were a little different. Mind you, a lot of the patients that we would get would be very, very sick because they waited until the last possible minute of their sickness or whatever condition that they were experiencing to come into the hospital. Why? Because they live on a farm. And when they come into the hospital to get treated, their animals could die. Or they live alone on acres of land. And my mom been on the floor for 4 days and nobody noticed because she lives alone and she never had any children and she doesn't have any family. So I never quite experienced death the way that I experienced it there because I've never experienced people coming to the hospital so late and so kind of like neglected. It wasn't as easy for them to get care as it is in the city. In the city, somebody know that my mom is on the floor, okay? She live in a house that's next to a house that's next to a house. These people really live on acres of land by themselves. So a lot of the patient population was very elderly. So one time I took care of this patient who was like 99 and she was a little confused and she was enjoying her soup. And then she looked up at me while I was trying to help feed her. And she said, "Oh, my mother used to own a girl that looked like you." So while I was explaining this to my class, I told them, now, while this still is racist, this is true. Like, she's not lying. She's not saying this to necessarily hurt my feelings. We were having very casual conversation and she looked up at me and something about my features reminded me of the features of the girl that her mother used to own. She meant that seriously and it's the truth and it's more so ignorance. Now, is it racist? Yes, Suan. Yes, it is absolutely racist. You should know that it is not okay to own humans. No matter if it was the norm back then, no matter how old you are, you should know that it's not okay to own humans like cattle. You should also know that it's sensitive and you probably shouldn't say it to me, okay? You should be embarrassed to repeat that back, ashamed that your family operated with such hatred to other people, to other human beings. Her and her descendants deserve to get boo-bopped, okay? Fades, no one is exempt. No one is exempt from a fade, even you at 99, Suan. Because that was still rude. And eat your soup before you aspirate. Go ahead and hush. So now that we got that out of the way, please do not take my words as if I am minimizing racism or the way that I was treated. What I more so am trying to explain is that it was a difference in the way that I received racism in the city. Because in the city, it's black B, you monkey A, B, like they actually have hatred for black people and they know black people and have experienced black people and still have these views. Whereas when I was in Gettysburg, they actually don't know any black people personally. They actually don't encounter black people personally. More so was just, I don't know any black folks. And the last one that I did know was in situations where we owned them. Like, I had another patient who had a Confederate flag. And whenever I came in the room, he would spin it to the back. And he would tell the CNAs, "I just really don't want to offend her. My grandfather fought in this war." That's how he really felt. He wasn't trying to be hateful towards me. This is really his history and this is a battle town. So again, not minimizing it. I just want to know.
Brothers and sisters, today we're diving into a very important and often overlooked topic: the experiences of black nurses and doctors in the United States who are raising their voices about racism in healthcare. This is not just about workplace struggles. It's about health, dignity, and justice. So let's take a deep look together. Now, healthcare is supposed to be the one field where fairness and equality are non-negotiable. When you're sick or in pain, the last thing you should worry about is bias. But reality tells a different story. Across America, black healthcare professionals, nurses, doctors, and medical staff are speaking up about discrimination they face at work. Many share that they're undervalued compared to their colleagues, questioned more often in their judgment, and even experience direct hostility from patients who refuse their care. Now, this is not just about personal slights. These experiences affect careers, mental health, and most importantly, the quality of care that patients receive. Let's look at the facts. Black people make up about 13% of the US population, but only around 5% of doctors are Black. The numbers are similar in nursing. Representation is far lower than the communities they serve. A national survey conducted by professional nursing organizations found that more than 60% of nurses of color reported experiencing racism from colleagues. Even more concerning, nearly 1 in 4 considered leaving the profession because of these experiences. Think about that. In a country already struggling with healthcare shortages, racism is driving talented professionals out of the system. Many Black nurses and doctors describe patients who flat out refuse to be treated by them because of skin color. Imagine studying for years, dedicating your life to healing others, only to be rejected not because of skill, but because of race. Others speak of being overlooked for promotions while watching less experienced colleagues advance. Some say their diagnoses and treatment plans are second-guessed, as if their expertise doesn't hold the same weight. And beyond the workplace, many also notice how their Black patients are treated. Pain not being taken seriously, complaints dismissed, stereotypes influencing medical decisions. As professionals, this is painful to witness because they know their patients deserve better. To understand why this continues today, we must look at history. Medicine in the U.S. has long had a complicated and often painful relationship with Black communities. From medical experiments done without consent to systemic exclusion from medical schools in the past. Those legacies don't just disappear. They show up in subtle biases, in hiring practices, and in the daily interactions of modern healthcare. The same way we talk about systemic racism in education, housing, or policing, it is also deeply present in healthcare institutions. The impact of racism in healthcare goes beyond the professionals. When Black nurses and doctors are pushed out or silenced, patients suffer. Studies consistently show that Black patients often have better health outcomes when treated by Black doctors. Why? Because trust matters. Because shared experiences matter. But if the pipeline of Black healthcare professionals is being drained by discrimination, that means fewer trusted providers for communities already facing health disparities. It's a cycle that continues unless it's broken. Yet, despite the challenges, many Black nurses and doctors are not staying silent. They're forming organizations, speaking to the media, and demanding reforms. They're mentoring the next generation of Black medical students, ensuring the path is less lonely. We also see professional associations pushing for diversity, equity, and anti-racism training in hospitals and medical schools. These voices are saying loud and clear, we belong here, and our presence is essential. So, what is the way forward? It's not just about diversity hires or slogans on a hospital wall. Real change requires accountability, holding institutions responsible for discriminatory practices, representation, ensuring Black students can access medical education and thrive, support systems, protecting healthcare workers from patient bias and workplace harassment, listening, truly valuing the lived experiences of Black professionals who know the system from the inside out. At the end of the day, racism in healthcare is not just a workplace issue, it's a public health crisis. When those who dedicate their lives to healing are themselves harmed by discrimination, the entire community suffers. But change begins with awareness, and awareness begins with conversations like this one. So let's keep talking, let's keep educating, and let's keep building bridges across the diaspora. Thank you for watching. Don't forget to like, share, and subscribe if you found this valuable. And let me know in the comments, how do you think we can better support Black healthcare professionals and ensure equity in medicine? Until next time, stay informed, stay strong, and stay real.